First off, I would like to introduce Naomi Kern. Naomi is the supervisor of the TB Control and Refugee Health Program at the Snohomish Health District. She started in the program as a public health nurse case manager, taking care of patients with active tuberculosis. Later, she transitioned into the supervisory role, training other nurses in tuberculosis. She received her Bachelor's of Science in Nursing from the University of Washington. And Naomi went to the Marshall Islands in the summer of 2018 as part of the CDC team that screened and treated people for TB on the island of Majuro. So Naomi, thank you so much for offering to present, and we look forward to your presentation.
All right, can you hear me?
Yes.
Okay, good. So my topic today is the QuantiFERON and the T-spot test. What do the numbers mean? Please advance the slide. I have no conflict of interests or any disclosures, as neither does my husband. Please go ahead. So the learning objectives are that the participants will be able to articulate what the different numbers in the QuantiFERON and T-spot results mean and apply this knowledge to better inform their clinical practice, and that they'll be able to interpret the results of the QuantiFERON and the T-spot in the context of their patient to determine if the patient needs treatment. Thank you. So you get a result like this on your fax or via the computer, and it says positive or negative. Is that enough just to know that? And I would say that it's not, that we need to actually look at the numbers and see what they are in the context of the patient that we are working with. I find that especially when it's right around the cutoff and when you're working with healthcare providers and you test them annually, it's important to really know what the numbers are. So go ahead to the next slide. So the first number that we see is the nil. The nil is the negative control. And what that shows us is there is any non-specific T cell reactivity in the background that's producing interferon gamma that might skew the result of the test. So basically it means, is there anything in the background of the immune system of the patient that might be causing a secretion of interferon gamma? With the QuantiFERON, in order for it to be valid, it must be under 8.0. And with the T-spot to be valid, it must be under 10 spots. Then we come to the mitogen. That's what it is called in the QuantiFERON, or the positive control. That's what it's called on the T-spot. So the mitogen is the positive control. And what they do with this tube is that they add some T cells to, or not TB cells, but non-specific T cells to the blood of the patient to see if it will even produce interferon gamma. The other thing that this measures is whether the blood has been processed correctly or whether it was transported correctly. So it also has to do with how the blood was handled. So for the QuantiFERON to be valid, the interferon gamma must be at least 0.5 international units per milliliter higher than the nil tube. And in the T-spot, it must be over 20. Next slide. Then we come to the TB-specific antigens. With the QuantiFERON, there's the TB antigen 1, TB, and the TB antigen 2. And in the T-spot, that's called panel A and panel B. So I thought I would bring some, or actually let's look at how it's interpreted first. So go to the next slide. This is the table that comes with the QuantiFERON in their brochure. I find it a little busy and a little hard to figure out, so I'll kind of give you a little clue as to how I look at it. So with the QuantiFERON Gold, in order for the test to be positive, the nil does have to be under 8.0. But then when you take the TB1 tube minus the nil value, or the TB2 tube minus the nil value, it must be over 0.35. So either tube, if they're over, minus the nil tube, if they're over 0.35, that's considered positive. For a quantiferon to be considered negative, again, the nil has to be under 8.0. And both the TB1 minus nil and the TB2 minus nil have to be under 0.35. There is an indeterminate category, and that is when either the nil is over 8.0 or the mitogen is under 0.5. In that case, you'd want to repeat the test. So on the next slide, we have the results for the T-spot. For it to be considered positive, it has to have 8 spots or more. Negative is 4 spots or less. And borderline are 5, 6, or 7 spots. And as we talked in other TB echoes, this is in the United States. In Europe, there is no borderline category. And they added it in the United States because we screen too many people who shouldn't be screened, and so we're trying to screen out the ones who are not truly positive or not truly negative. So I thought we could look at a couple results to kind of go through and see how you determine whether it's positive or negative. I will say I only have one T-spot result because we only used it for a year, so I don't have too many examples. So if you look at the results on the bottom, the nil is 0, which is a good result because it's under 10. Panel A spot is 0, the panel B spots are 10, and the positive control is over 20. And so that's also good for the positive control. So if you took panel A, which is 0, minus the nil, which is 0, it's 0. And then if you take panel B, which is 10 spots, you do minus the nil, which was 0, it equals 10. And so it's over 8. So we have panel A, which was under 10, but panel B is under 8. And panel B is over 8, and so it's considered positive. In the next example, we have a quantiferon result. So if you look at the TB1, it's 0.05. The TB2 is 0.04. The nil is 0.09. It's under 8, so that's a good result. The mitogen is 5.42, which is over 0.5, so that is also a good result. So then we go and we do the TB1 minus the nil, which actually gives us negative 0.04. And when we do the TB2 minus the nil, it's 0.05, so they're both under 0.35, which makes it a negative result. In the next example, flip the slide. The TB1 antigen is 5.76, the TB2 is 8.22, the nil is 0.43, so it's under 8.0, so that's a good result. Mitogen is over 10, so that's a good result as well because it's over 0.5. So when you take the TB1 minus the nil, it's over 0.35. TB2 minus the nil is 0.35, and so that is considered a positive result. Next example, the TB1 is 0.04, TB2 is 0.03, the nil is 0.04, that's a good result, but the mitogen is 0.08, which is under 0.5, so that is an indeterminate result. One thing I ran across when I was doing my reading that I think really informs the results, it said the predictive value of a positive quantiferon result, and I would say a T-spot result as well, in diagnosing MTB infection depends on the probability of infection, which is assessed by historical, epidemiological, diagnostic, and other findings. So obviously we have to take these results in the picture of the whole patient and not just as positive and negative.